Hello everyone, welcome back to my channel Dr.shil's Physio with Trick. Today I'll discuss the second part of GSSSB 2016. Let's start. Today's first question is: a patient developed arthritis in unilateral subtalar joint after an injury. While ambulating, it is most likely that the patient will experience the least pain. Here they call the least pain. Option A, at push off on involved side. Option B, going up an inclined plane. Option C, at heel strike on involved side. Option D, on an uneven terrain. Here the correct answer is option B, going to an going up on an inclined plane. Basically, heel strike involves initial contact with inversion and eversion adjustment. Arthritis here could cause early stance pain. Push-off requires stability and possibly motion through subtalar joint for forefoot adaptation. Likely painful if arthritic. Uneven terrain stresses inversion and eversion constantly. It's very painful. Walking up an inclined trend to limit subtalar motion because the ankle flexion and the foot may be more fixed. Next, come to question number 27. The demographic information on the subjects in a research study lists a mean age of 32 and median age of 35. The difference between mean and median indicates option A, the value of the Z score, option B, that the distribution is skewed, option C, that the two measures should be averaged, option D, the value of the standard deviation score. Here, the correct answer is option B, that the distribution is skewed. In statistics, the mean is the average value while the median is the middle value in an ordered data set. Option A is Z value is a standardized value. Option C is basically is not indicated. Option D is related to spread, not the central tendency. Next, come to question number 28. In which group of athletes is more prone for sternoclavicular joint sprain? Option A, cricketers. Option B, wrestlers. Option C, tennis players. Option D, swimmers. Here, the correct answer is option B, wrestlers. Sternoclavicular joint sprain occurs from direct trauma or fall on an outstretched arm. Maybe a forceful impact to the shoulder can also be a cause. Wrestlers are highly prone due to the contact nature of the sports, involving tackles, throws, and ground impacts. Cricketers and tennis players experience more overhead or rotational shoulder stress. Basically, these two involves more rotator cuff injury. rotator cuff injuries. Swimmers basically face repetitive strain but less direct trauma. Next, come to question number 29. When held in supported standing, a 12 months old spastic diplegic child on the tiptoe with toe curled up. This position is characteristic of option A, Moro reflex, option B, plantar grasp reflex, option C, traction response, option D, proprioceptive placing reaction. Here, the correct answer is option B, plantar grasp reflex. In spastic diplegic cerebral palsy, lower limb spasticity leads to equinus position and persistent primitive reflexes. The plantar grasp reflex normally integrates by 9 to 12 months, causes toe curl when the ball of the foot is stimulated. Basically, in spastic child, it persists, contributing to its position. Moro reflex is a startle reflex response, traction response involves arm flexion, and proprioceptive placing is a stepping reaction. Next, come to question number 30. A handicapped person is eligible for concession if he or she has option A 40% disability, option B not less than 40% disability, option C 50% disability, option D a combined total of 60 or 40% in individual disability. Here, the correct answer is option B not less than 40% disability. Under the Persons with Disability Act, a person is considered disabled and eligible for concession if they have at least 40% disability certified by a medical authority. Next, come to question number 31. Heberden's nodes are present in option A wrist, option B subcutaneous tissue, option C DIP joint, option D shin of tibia. Here, the answer is very easy. Option C, DIP joints. Heberden's nodes are bony enlargement of osteophytes, basically uh, seen in the distal interpharyngeal joints, commonly seen in osteoarthritis. Of the hand. They result from cartilage degeneration and bone remodeling. Next, come to question number 32. A patient is diagnosed with a herniated disc at level 4. Which of the following will have the most weakness? Option A, knee flexion. Option B, knee extension. Option C, ankle dorsiflexor. And option D, hip flexion. This is very important and very interesting question. Here, the correct answer is option C, ankle dorsiflexion. A herniated disc has L4 typically refers to the L4 and L5 intervertebral discs, which compresses the leads to compression of the L5 nerve root. N5 nerve root. The L5 nerve root Primarily innervates the tibialis anterior and extensor hallucis longus. Knee flexion is hamstring, S1 and S2. Knee extension is quadriceps, L3 and L4. Flexion is iliopsoas, the root value is L1 to L3. Next come to question number 33. The principle of Frenkel's coordination exercise is an R. Option A, precision. Option B, attention. Option C, repetition. And option D, all of the above. Very easy question. The answer is D, all of the above. Frenkel's exercise. Frenkel's exercise designed for cerebral ataxia. Sorry, cerebral ataxia. Which emphasizes three main principles. One is concentration, attention is concentration on movement. Precision is accurate performance. Repetition to reinforce neural pathway. Next, come to question number 34. Which therapeutic effect will differentiate between cold and heat treatments? Option A, relieving pain. Option B, reduction of spasticity. Option C, reduction of spasm. And option D, none of the above. Here, the correct answer is option B, reduction of spasticity. Cold basically reduces nerve conduction and reduces spasticity. And heat may increase spasticity initially. Next, come to question number 35. A person has head injury 3 months before. At present, he can understand and wants to talk to people but can't. Which is this aphasia called? Option A, receptive. Option B, expressive. Option C, global. And option D, none. Here, the correct answer is option B, Expressive, expressive is also called the Broca's aphasia. Broca's aphasia often from frontal lobe injury or head trauma, which impairs speech production while preserving comprehension. The patient understands language and intended to speak but struggles with output. Receptive is receptive is Wernicke's Wernicke's and global is both. Next, come to question number 36. It is not sign of injury to lower motor neuron. Option A, hypertonia. Option B, reduced tendon reflexes. Option C, flexor plantar response. Option D, fasciculation. Here, the correct answer is option A, hypertonia. Lower motor neuron causes flaccid paralysis with basically hypotonia and reduces reflexes, and there is also presence of fasciculation. The flexor are absent of plantar response. Next, come to question number 37. Parkinson's gait is called as option A, circumduction, option B, short shuffling, option C, antalgic, and option D, waddling. Here, the correct answer is option B, short shuffling, Parkinson's gait or fascinating gait or short shuffling gait. Reduces arm swing, forward stooped, and acceleration as if chasing the center of gravity. Circumduction is seen in hemiplegia. Hemiplegia. And antalgic is in pain, limping, wetting is seen in gluteus medius and minimus, weakness, and also in bilateral pain. Next, come to question number 38. EMG is used in diagnosis of option A, myopathies, option B, myasthenia gravis, option C, myotonia, and option D, all of the above. Here, the correct answer is option D, all of the above. EMG assesses basically muscle electrical activity. Myopathies shows small motor input potential, and the myasthenia gravis shows repetitive stimulation, and myotonia shows characteristic discharge. Next, come to question number 39. Hip joint is supplied by dash segments. Option A, L1 to L3. Option B, L2 to L5. Option C, L2 to S1. Option D, L3 to S2. Here, the correct answer is option C, L2 to S1. The hip joint receives sensory innervations from femoral nerve Root value is 4. Obturator nerve root value L2 to L4. Branches of sciatic nerve root value of L4 to S1, which total spanning from L2 to S1 segment. Next, come to question number 40. A patient with spinal accessory nerve injury will have difficulty in option A, shrugging of shoulder, option B, adduction of scapula, option C, shoulder rotation, option D, horizontal abduction. Here, the clear answer is option A, shrugging of shoulder. Shrugging of shoulder is by spinal accessory nerve or cranial nerve 11, which innervates the trapezius muscle. The function of trapezius is elevation of scapula for shoulder shrugging. Next, come to question number 41. Cerebellum is concerned with option A, posture, option B, voluntary movement, option C, balance, and option D, all of the above. Here, the clear answer is very easy. All of the above. The cerebellum coordinates voluntary movement, maintains posture, and ensures balance. Next, come to question number 42. It will be best to employ to differentiate between the pain originating from sacroiliac joint as opposed to hip pathology. Option A, straight leg test. Option B, Nobel compression test. Option C, Faber test. Option D, compression distraction test. This is very important question, and uh, the actual answer is compression distraction test. But in the answer key, the answer is given Faber test, but Faber test cannot differentiate between SI joint and hip pathology. The Faber test is used in the both cases, but in compression distraction test, we can identify the SI joint. The compression distraction test applies force to stress the sacroiliac joint ligament specifically, reproducing pain in the SI origin. Next, come to question number 43. Ankle dorsiflexion and contraflexion takes place. Option A, sagittal plane and frontal axis. Option B, frontal plane and sagittal axis. Option C, transverse plane and vertical axis. And option D, coronal plane and horizontal axis. Here, the clear answer is very easy: sagittal plane and frontal axis. Next, come to question number 44. Dash order lever is the lever of speed. Option A, first order, option B, second order, option C, third order, and option D, all of the above. It's also a basic question. Third order lever is called the lever of speed. Second order lever is the lever of power. Next, come to question number 45. The appropriate current to know tendon rupture. Option A, Faraday current. Option B, tense. Option C, galvanic current. And option D, none of the above. Here, the correct answer is Faraday current. Faraday current tests muscle contraction. If the muscle contracts but the joint does not move, it suggests tendon rupture. Next, come to question number 46. In 10-point scale of RPE, 60% of the heart rate reserve responds to option A 4, option B 6, option C 3, and option D 5. Here, the correct answer is 4. Basically, 60% is moderate intensity exercise, moderate intensity exercise. Next, come to question number 47. In normal standing, the line of gravity passes where the knee joint. Option A in front of, option B behind, option C through, option D lateral to. Here, the correct answer is option A in front of, uh, basically. If I start from above, sorry, unable to draw. I just write. First is from the external auditory meatus. Second is from body of the fifth lumbar vertebra. Third is from anterior to the S2. Fourth is posterior to the hip joint axis. Fifth is anterior to knee joint. Sixth is anterior to anterior joint axis. Next, come to question number 48. Usually, suction pressure for an adult is option A 80 mmHg, option B 100 mmHg, option C 120 mmHg, and option D 70 mmHg. Here, the correct answer is 120 mmHg, standard suction pressure for adult, uh, because it is effective for removal of secretion without causing mucosal trauma or hypoxia. For 60 to 80 mmHg is used for neonates. 80 to 100 mmHg is used for infants, and 100 to 120 used for adults. Next, come to question number 49. One of the following statement is false. Option A, the government gives scholarship to PWD. Option B, the government assists organizations working for PWD. Option C, the government assists persons with disability to purchase orthosis. Option D, income tax concession is not for mentally retarded. Here, the correct answer is option D, because uh, under section 80U of the Income Tax Act, persons with mentally retarded are eligible for tax deduction. Next, come to question number 50. Coefficient of friction on the floor should be more than option A 0.01, option B 0.1, option C 0.04, and option D 0.4. The correct answer is option D. The coefficient of friction is basically mu, denoted by mu. Mu is frictional force by the normal reaction the coefficient of friction for floor should be 0.4 to minimize slip risk during walking as per safety standard. Should be 0.4 to 0.6. Thank you everyone for watching this video. Please do like and subscribe to my channel. And if you find any answer is wrong, please pin me in the comment box. And what type of video and what topic you want in the next video, please comment me on the comment box.